Hello and welcome to Wellness Wednesdays. My name is Sally Duplantier. I am the founder of a company called Zing, and I am also the host of Wellness Wednesday. And today it's kind of fun because I get to be a co-presenter along with Elizabeth Edgerly. So Elizabeth, welcome. Um, for those of you who are just joining us, you should be able to see the slides and you should be able to see both me and my co-presenter, Elizabeth. If you can't see both of us, you can adjust your settings in your own Zoom room. So today's topic is it Alzheimer's or just normal aging? And these programs are made possible through the generous support of our community. As many of you know, these programs are free to all, but they're not free. So I do want to thank the people who have so generously sponsored Wellness Wednesdays. Thank you so much. And today it's pretty exciting because we have a number of promoting partners. So many organizations that we're getting the word out. And I'm delighted that we have 229 registered participants from 5 countries who have registered for today's program. So I am delighted to introduce my co-presenter, Elizabeth Edgerly. She is the executive director and regional leader at the Alzheimer's Association of Northern California and Northern Nevada. That's kind of a mouthful. But she's also a licensed clinical psychologist, and she specializes in topics related to brain health and Alzheimer's. She was named as Woman of the Year for her work related to Alzheimer's by the Women's Healthcare Executives in 2013. And her bio could go on, but we're going to keep us moving. A little bit about my background. So I think a lot of you know me. I am a gerontologist and I'm also a health span educator. And I have been working on Alzheimer's research since 2021. I published a paper with Dr. Christopher Gardner from Stanford, looking at the link between diet and cognitive decline. I just published last week a new article on how to improve the health and well-being of family caregivers of Alzheimer's patients. And I'm working on a project that's funded by the American Heart Association, looking at ways to increase diversity in clinical trials of Alzheimer's patients. So a little bit of background about both of us. And here's what we're going to be covering. We're going to talk for about 35 minutes, and then we're going to open this up for Q&A. So as we go, if you have questions, just type them into the Q&A because we'll have ample time to discuss them. But first, we're going to start with the basics. You know, what is Alzheimer's and how does it differ from other forms of dementia? Then Elizabeth and I are going to talk about the 10 early warning signs. And she's going to present things from the perspective of Alzheimer's research. And I'm going to talk about normal aging from the perspective of a gerontologist. And then we will be also talking about how to take action, how you can reduce risks and get help either for yourself or a loved one. And I'll be sending the recording along with other resources to everyone who's registered. All right, so Elizabeth, go ahead and come off mute and let's talk a little bit about Alzheimer's and dementia.
Awesome. Thank you, Sally. It's really a pleasure to be here. Hi, everybody. Nice to connect. I can't wait to hear your questions, your thoughts as we go along. But again, thank you, Sally, and congrats on your publication that just came out. So I like to start by talking about what dementia is. And the reason I do that is because this is a term that's used a lot and it's very confusing to people. It's a syndrome that represents a collection of symptoms. So it's not a disease in and of itself. It's really an umbrella term that means that a person is starting to have cognitive decline and they're changing from the way they used to be and they're getting worse. And it can be involving cognition, behavioral changes, psychological symptoms. So often at the Alzheimer's Association, we'll have a conversation with someone where they say, well, my mom was just diagnosed with dementia. Thank goodness it isn't Alzheimer's disease. And I'm always a little puzzled by that, because when you look at this screen and you look at the umbrella, dementia is an umbrella term. There's a whole group of diseases and conditions that lead to dementia. And as you can see, 60 to 80% of dementia is Alzheimer's disease. So when someone says to me, oh, my mom was diagnosed with dementia, thank goodness it isn't Alzheimer's, I wonder, what is it? What's causing the symptoms of dementia? And did they even get a diagnosis? Because most often, unfortunately, people don't get diagnosed. They may get that generic label, but not know what's causing it. And the reason I'm going into this detail is it matters. There's a big difference between vascular dementia caused by tiny strokes and frontotemporal dementia, which we've been hearing about in the news because of Bruce Willis and his diagnosis of frontotemporal dementia. So understanding what's the dementia is very helpful in terms of understanding what is the symptoms, what are the symptoms going to look like, and what would the treatment be. So as you can see, Alzheimer's is the #1 most common cause, but often it's not the only thing going on. It may be Alzheimer's plus vascular. The other thing that I know Sally and we're going to talk more about is there are things that can cause people to look like they have dementia, but actually that can be reversed. So we talk about reversible dementia, and you absolutely want to figure out if you have something like that, because of course we all want to do as well as possible for as long as possible. So anyway, so that's kind of an overview. So let me ask you one question. I want you to think about this. So does everybody with dementia have Alzheimer's disease? Sally, what do you think?
No.
No. Does everybody?
There's a variety of forms of dementia. Yes.
Exactly. But does everybody with Alzheimer's have dementia, at least at this point in time? Yeah, yes. They are synonymous in that case. And that's where the confusion gets, gets part of this, is that we use these terms interchangeably. So everybody with Alzheimer's, the way it's defined today, has dementia, but not everybody with dementia has Alzheimer's. So
that's a great clarification. Yeah. Thank you. Yeah, I love this opening slide.
So this is, now I just said something that you're gonna call me on now, because you're like, wait a minute, you just said that everybody with Alzheimer's has dementia. And that has absolutely been the way that we talk about it, is they go hand in hand. Alzheimer's is causing significant cognitive decline over time. However, look at what this slide shows. Alzheimer's disease is a continuum. We are now at a point scientifically where we know that there are people who don't have cognitive symptoms, but have the hallmarks of Alzheimer's in their brain. And this is, of course, exciting to many of us, myself included, where I think, my gosh, imagine if I could find out that I have amyloid and maybe even plaques in my brain, but I could do something. I could do something to stop it from progressing. And that's what we're looking at here, is in research settings, it is possible today to identify people who have the hallmarks of Alzheimer's, but who do not yet have the cognitive symptoms. And so that still is research, but someday we hope that's going to be clinical care, where we could find out so early that we never have to deal with the cognitive impairment because we could intervene. So this is the new model of a continuum for Alzheimer's disease. And so we would have asymptomatic, where you have biological changes. Mild cognitive impairment is a major factor that is often invisible. Very rarely is it diagnosed, and yet it is the stepping stone for many people to Alzheimer's. And so what is MCI, or mild cognitive impairment? This is where someone, I'll use myself, let's say my memory is absolutely changing and I have memory lapses that are causing me difficulty in my daily functioning. That would be an example of me having mild cognitive impairment. I'm okay otherwise, but my memory is significantly different from normal. And that's an example of mild cognitive impairment. If I have memory issues and I have language issues, that would then put me over into dementia. So in other words, if it's one and only one symptom, like memory loss, that would be mild cognitive impairment. If it's more than one, it turns into a diagnosis of dementia. And then you can see how it progresses here. Early stage, people are very capable of doing many things in their life. Over time, it progresses to moderate, where people really need 24-hour care. And of course, in the later stages, individuals are completely dependent on others. So that's kind of the new continuum that we're working with.
And Elizabeth, I'm going to add a couple of things. I think what's exciting from a research perspective is that we're starting to research this earlier, because the earlier we can detect changes in the brain, the earlier we can detect the effect of, for example, high blood pressure in midlife or lack of sleep in midlife and leading to dementia. The earlier, the better.
I agree.
The other thing I would say is that Wellness Wednesdays attracts a very educated audience. And so for people who are highly educated, it's often kind of easy to hide these symptoms from yourself, from others. But what you're going to see is Elizabeth and I encourage you to get help if in doubt, because the earlier the better.
Yeah, I love your comments, Sally, about highly educated people can fake it, frankly. And my mom did that. She wasn't highly educated, but she faked it for a long time. And we'll talk more about that, where she memorized the questions she was going to be asked, and she actually practiced before she went in. I thought, oh my goodness. So we'll talk more about that in a little bit.
So we want to talk about early warning signs, things to be aware of, not to be afraid of, but to create awareness. So Elizabeth, let's look at this first one, memory changes. Tell us about what might indicate that it's an early warning sign of and we're going to call it Alzheimer's, but we know it could be Alzheimer's or another form of dementia.
Or even something that's reversible.
Yes. Yes.
So, and I know we're going to talk about that because, yeah, so don't panic as we're having this conversation if you see yourself. But so memory changes that disrupt daily life. And Sally, I'm going to do my best to not steal your comments as a gerontologist here, because I always do that. But let me give you some examples. I mentioned a moment ago, I used myself as a hypothetical example of someone with mild cognitive impairment with memory issues that affect my daily life. So let's talk about what that would be, where those around me are really noticing that I don't remember things that have just happened. So we maybe had a whole conversation about which movie we were going to go see, and I'm coming back 5 minutes later saying, did you want to go to the movies? That's one where you're like, oh, wow, do you not remember that entire conversation that we just had? It could also be forgetting to pay your bills repeatedly. So I wouldn't say if you forget to pay your bill, occasionally, I mean, who hasn't? Occasionally, I will forget to pay a bill. But if that happens so much that you start to have consequences from it, that would be an example of a memory change that disrupts life. So now you're going to tell me what's normal memory loss, right?
And so and some of these kind of overlap, but we all have memory changes. And yes, there are memory changes that are associated just with normal aging. It's not unusual if you go into a room and you can't remember why you went there. That's kind of normal. In fact, a lot of these are just not paying attention. It wasn't really top of mind. So it's this distinction between, is it interfering with your daily life, or is it just something you forgot?
Yeah, I love that. I think the other example I use of normal, have any of you noticed that it's harder to remember people's names? That is quite pervasive. I'd be curious in chat, like how many of you have had this experience, or rather, how many of you have not had this experience because I want to meet you,
Let's see if
that's so common. Almost everybody notices how they are today. And I'm in my later 50s, so I really notice it. But even in your 40s and 30s, you can notice this.
yeah, and people,
All
the
right.
chat's lighting up. People are admitting to it. And we had Daniel Schachter. He's a professor at Harvard. He talked about the 7 sins of memory, and he said one of the big sins of memory is not paying attention. So
Yeah, absolutely.
with names, it's just like somebody says their name and you're not paying attention. But
Yeah.
yes, it may happen more frequently as you age. Or, you mentioned Bruce Willis. Like sometimes you're thinking of a popular actor and you're like, oh my God, what's his name? But
I did that. I almost did that just now. I was like, oh my gosh, what's his name? All right. Well, let's go to the next one.
Let's go
So
to
I know memory, we're all,
right.
almost all of us are going to be able to relate to number one. So don't panic if you're like, oh, my memory isn't what it used to be, right? It needs to be something pretty significant for us to say, take a look at that. And we'll give you more examples. All right, the next one, challenges in planning or solving problems. So let me give you some examples of this. Imagine that you are planning your day or planning a party for someone. Do you start to have difficulty working through all the steps that go into holding, let's say, a party or a dinner, or even, planning what you need to get at the grocery store in order to bake something at home? So this is where we're getting into more executive functions, where we're trying to plan. So first this happens, then this happens, then this happens. Again, can we forget something at the grocery store? You betcha. However, if I can't plan a dinner party for the life of me, and I've always been able to do it before, that might be an example of something. So what are your examples of normal?
Well, and Elizabeth, I think you bring up a good point, and you've always been able to do it before. So let's say that I'm planning a baby shower for a granddaughter, and maybe I simply oh my gosh, like I know we needed flowers, and I didn't think about flowers. That's okay. That's not a problem. But it's more of when this becomes like a day-to-day kind of situation where you're starting to feel a little bit lost, because even something simple like hosting a dinner party or having your kids over for dinner becomes problematic because of the steps involved.
Mm-hmm.
Yeah.
And think about this too. So let's say it's also about problem solving. So parts of our life, like as Sally knows, I just moved into a new office today, right? And think about all the things that go into moving. And someone who's been able to work through something like that, lots of moving parts, right? When you do that. And if all of a sudden you notice that, wow, they really can't do this anymore, this is a huge barrier for them, that would be one you're going to make a mental note, go, okay, that's a concern. And we're going to come back to that in a little bit.
Yeah.
So let's go to difficulty completing familiar tasks. So the one I like to use as an example here is finances. Again, familiar tasks. So if someone is has always been able to write a check, pay their bills, do their taxes, make change. I'm using those as examples because that type of ability can be affected very early in someone with Alzheimer's. So that would be an example that all of a sudden, if I can't write a check or make change for a 20, or figure that out, do my taxes because I already do my taxes, right? Then that would be something that could be an example.
Yeah. A counterpoint is an experience where you are sure you wrote a check, but you didn't, or you wrote the check for the wrong amount. That's really not problematic. I'll use an example of Excel. One of the interviewees that I talked to for my most recent research said her father, who was an aeronautic engineer, couldn't remember how to click like the close button in Excel, the little X, like, and he had done that over and over and over. So
Mhm.
that's an example to be concerned. But the flip side is if you're in Excel and you, for some reason, you can't remember, oh my God, how did I do this function or that function? Or how did I add that up? Even if you've done it a lot, one time being kind of confused with something,
Yeah.
that's really nothing to be concerned about.
Exactly.
Yeah.
And I actually would go even further. I would say around use of new technology, because I think, oh my goodness, it's changing constantly, right? Just when you think you've mastered the iPhone, like when they changed it, I looked like I had no idea what I was doing because they changed the functionality. So I think that's a great example of normal aging,
Yeah.
that
I
technology is outpacing us pretty quickly,
yes,
right?
coming from the perspective of someone who like Zoom every week, it's a new
Yeah.
experience. Oh my
Yeah,
God.
yeah,
Yes.
yeah. So the next one, now this one I think is an interesting one, confusion with time or place. This is one you're going to notice later. I'm going to come back to this. If someone is having a hard time recognizing where they are, what time it is, like what's going on around them, that is cause for concern.
Yeah.
Full stop.
Yeah.
Yes, you can wake up on vacation and be a little blurry-eyed and not know where you are. I'm talking about really like, where am I right now? Getting lost in familiar places. Those kinds of
Yeah.
things are
Yeah.
concerning.
Going to your grocery store, for example, and not remembering how to get home, that's a
Yeah.
cause for concern.
Yeah.
But and this example I'm going to give, some of it has to do even with social isolation. Is you may
Mhm.
be convinced that it's Thursday, but it's Wednesday, and that happens to us.
Yeah.
The other
Oh
one
yeah.
to us, and it's scary, is you put an appointment on your calendar, whether it's electronic or handwritten, you put it on the wrong day. Now, if it happens over and over again to the point where you're like, I don't even know how this got here, that would be a cause for concern. If
Yep.
it happens once in a while, it happens to the best of us. I don't even know if it's always aging related or not.
Yeah.
So that's not a concern.
No, I like that example. I started laughing when you said you think it's Thursday, but you think it's Wednesday. During the pandemic, my colleague, it was a Tuesday, and I said hi to my friend, my colleague, and said, "So how's it going?" She's like, "Oh, thank God it's Friday." And I thought it was a joke because it was Tuesday, like it wasn't anywhere near Friday. And I started laughing, and then I realized she didn't realize it was Tuesday. But wasn't that the pandemic for so many of us?
Right.
It was like, blah. So we're not talking about that. That was a whole other experience. Okay, so the next one, trouble understanding images and spatial relationships. Now, this one is a little more unusual. This does not happen quite as commonly in Alzheimer's, but there are some other types of dementia, so alcohol-related dementia and some of the other related disorders. And I keep looking at my paper because as a psychologist, I would do testing on people and ask them to draw a cube. And there are certain types of dementia where individuals could not, for the life of them, draw a cube or really understand what something was, or understanding the distance between things. So what we'll hear from people with Alzheimer's sometimes is, if you've ever had the experience where you feel like you're falling upstairs, have you had it where stairs aren't quite even? And it's very disconcerting. I've had people with Alzheimer's describe that they feel like that a lot. And it's this distortion of the distance and their body in that distance. So I'm talking about that relative to the spatial relationships, our ability to process. So this would be one that could be caused by things other than Alzheimer's.
Yeah, yeah, absolutely. And what I will stress on the aging side is that something that's associated with aging is a decline in vision. So you may have vision problems because of cataracts, glaucoma, macular degeneration, and you're having trouble seeing because of those.
A bifocal.
Or yeah, yes, new progressive lenses.
Yeah.
Absolutely. The other thing is that our visual acuity changes as we age, and we have more trouble driving at night. We just can't see as well. So all of those are normal, normal parts of aging, but it's really good, as we've been talking about, to get it checked out, to rule out something, that could be a different medical cause.
Great examples. All right, so the next one. Now, I did see in the chat, I saw some of you talking about the tip of the tongue, and I know that Sally's going to say that in response to this. But so this one, new problems with words in speaking or writing. Notice new, right? That's a major thing. We all experience changes in communication as we get older, and it can be kind of aggravating, right? But is it so aggravating that it is interfering with your ability to carry on or understand a conversation? That's what we're talking about. Are you able to write an email and have it be coherent? In some individuals that we work with in the early stages, that's where they start to see it, is that they just can't put the words together in an articulate way like they used to. And in particular in writing. Now, this isn't true for everybody with Alzheimer's, but it is true for many people that this can be a difficult thing. And it's especially difficult when you have that cocktail party effect happening, when you're in a group setting and people are distracting, and then it can become even more difficult. So that's my example.
And that's a great example. And yet I can give you many examples that are completely normal. So,
yes.
The term aphasia is used. That's the kind of the technical term for when we lose a word. Like, what was that word? I had an experience the other day, maybe 6 months ago. It scared the heck out of me. I couldn't remember the word dishwasher. I'm looking at the dishwasher. I finally, I panicked. I couldn't tell my husband. I said, that thing you put plates
that
in.
thing you put dishes in to clean it. That's normal. That's a perfect example of normal.
That happens. The other thing I think is normal, and I'm guilty of this, is that we're having a conversation, maybe Elizabeth and I are talking, and I kind of go off on a little side tangent. I might tell her what I had for breakfast, and then I can simply not remember what the thread of the conversation was. And, like educated people, you might be able to kind of make up for it, but sometimes you just have to say, oh my God, I don't even know where I was going with that.
Yeah.
That is normal. Is it happening all the time? Is it every conversation? That may be a cause for concern. Once in a while, not really.
Yeah. Sally, I loved your example of the dishwasher. The other thing for you to test out, all of us, I just had this the other day where I was trying to think of something. It could be a name, it could be an object or a noun or something. Stop trying to think about it for a sec. And it's interesting. It's like when you kind of wipe the slate clean for just a little bit, often your brain comes right up with the name you need because there's this interference happening in your brain. So I loved your example of the dishwasher. I bet if you just stopped trying for a minute, it would have popped back in and you would have shouted out dishwasher, right? So,
exactly. And I think you bring up a good point that's kind of part of the normal part, is that you do remember that word, especially if you're not trying so hard. Yeah.
Yeah. Let me mention one other thing. Now, this is someone who had more advanced dementia, not Alzheimer's, actually. And he was highly educated, incredibly successful, internationally recognized physician. His daughter shared this story that his wife asked him to take the dishes out to the sink. And he said to her, "What is sink?" And that, you would have a sinking feeling if that was your loved one. You'd be like, what do you mean? What is a sink? That will take your breath away. If you have anything like that on this list where it takes your breath away, we're going to come back to that, because that's kind of my experience with this. Is sometimes it's not so subtle. It's going to hit you right over the head and you're like, oh, that's major. And I have to say, I think a lot of time your gut is, if it's major, your gut's going to tell you it's major, right?
Yeah.
So, all right, next one, misplacing things and losing the ability to retrace steps. Yeah, I saw this in my mom a lot when she started to experience dementia. She would put things in unusual places too. So we would find the milk in the cupboard or the ice cream in the drawer. And that's a very sad thing because you're cleaning up, kind of a mess. But so misplacing things certainly is an issue. And as you can see, and losing the ability to retrace the steps, that short-term memory really starts to have trouble.
Elizabeth, give us an example of retracing steps. How might that occur?
Yeah. So, well, now I would bet you're going to say a normal experience in aging is you lose your car keys sometimes. Right?
Well,
Actually, I just did this the other day. So I lost my Fitbit. I have this Fitbit, and I have certainly a habit. A lot of our good memories habit, isn't it? And so I usually have it in a certain place. It wasn't in any of the places I would normally have it. And so I thought, what was I doing? And I thought, oh, my bathrobe. I bet you anything it's in the pocket of my bathrobe. And so I went, boom, it was in the pocket of my bathrobe. So that's an example. I was able to retrace my steps. That would be the kind of place I would put it. Oh yeah, I did it.
Right. Yeah, I mean, so that's an excellent example. Even if you don't find it in your bathrobe,
No.
you can go, oh, where was I?
What?
Yeah. I think, this idea of misplacing things, whether it's your car keys, your iPhone, your checkbook. So often I hear people go, oh, I'm having a senior moment. I lost my ex. We all have this.
Sure.
Yes, it might get a little bit worse as we get older, but most of it is that we're not paying attention, or we don't have, as Elizabeth said, good habits. If you put your keys someplace different every time, chances are you're going to forget where they are.
Yeah.
So, yeah.
Well, and I want to ask you guys in chat.
Okay.
I like Bonnie. Bonnie, you keep putting the best comments in there. I love your comments. I have to say, Bonnie made a comment about hearing earlier, and I want to say, yes, hearing issues when talking about communication, major issue. But have any of you ever lost your car?
Yes.
I have.
And I was younger. I was younger. Okay. Yes, Amy's lost her car.
Yes,
oh my gosh.
I lost my car. I was so embarrassed. I lost my car because there were identical parking garages at San Francisco State, and I went to the wrong, they're next to each other, and I wasn't paying any attention. Anyway, so don't panic, but if you do that repeatedly, that might be one of those things where you're like,
You go out of a shopping center and you have absolutely no idea.
It's a bad thing.
I lost my car in Chicago. It's something similar with the two different parking levels, but I actually called the police and told them my car was embarrassing. Yes.
Oh no. All right. See, you guys are going to all feel better about your memory when you hear Sally and me losing our car, right? And all right, decrease your poor judgment. Now, this is one that I would highlight. And I say I would highlight because one of the first warning signs we see is that someone can fall victim to a scam. And how many times, I don't know how often you all are approached with either a phishing email or a call from the fake IRS, or I was getting called by the Chinese government like over and over and over again. And the fake IRS one really got me a little bit, meaning I was like, ooh, I got a little sweaty, and I thought it's got to be a scam, but what if it isn't, and so I'm Googling it, but think about that. I recognize it as suspicious. I know what steps to take to determine whether it's real or not. I know how to hover in the right place on an email to see that fake, right? There's things you learn, but there's also this awareness that gets lost really early in people with mild cognitive impairment. And so in studies, they've actually found when they ask people, kind of present them with a scam scenario, almost 0% of the people with mild cognitive impairment recognized it as a scam. It was 0. So Sally, what's your normal? And people with normal, I mean, any of us can be caught.
You can still There was one over at Christmas where I was getting a message from UPS that they couldn't deliver my package because I had an incorrect address. I thought it was like, I almost clicked. And I would
Oh,
say that if I did click, I don't think that necessarily means I have dementia.
no,
It
no,
means
no.
I was fooled. But Elizabeth, what you're saying is that it's that inability to even distinguish. Yes, yes.
Yes.
Yeah,
And I would say the obvious. So, I mean, many of us have, been tempted, or actually, not just been tempted, but been caught. But think about, like, how far along the pathway do you start to get suspicious? So if someone says, good news, you won the lottery, I just need you to send me $2,000 to collect, right? That's one of the big scams. Send me money so you can win money. So be careful. It could also be wearing the wrong kind of clothes, not dressing for the weather, saying things that are inappropriate that you would never have said before that may be hurtful. So this has a whole lot of stuff in it, right? Yeah. I just wanted to say, be careful about the scams, because that happens a lot.
yeah.
All right, let's go to
poor judgment could just be poor judgment. Like last weekend, my husband was out of town. I said, I think I'm going to puppy sit 3 dogs. How hard could it be?
Bad idea, huh?
Bad idea. Yeah.
That's normal. That's normal bad judgment.
Normal bad idea.
Yeah, I love it. Actually, I love that example, Sally. I think that's a great example. It's just like, okay, now I know, right? Withdrawal from work or social activities. This one is not going to hit you over the head, is it? It's withdrawal. It's probably one of the most common warning signs that we'll see. If you think about yourself, if you are feeling unsure of your memory and your ability to communicate, are you going to put yourself out there, or are you going to withdraw? And much more often, people withdraw from conversation, from interaction, from friendships, etc. That's where
And this has
we'll
been
see it.
exacerbated by the pandemic and by shelter in place. And it can also be exacerbated by normal age-related decline, for example, in hearing or vision. If you have those problems, you're more likely to withdraw, for example. The challenge, however, is that lack of social activities puts you at far greater risk for dementia. So it's what
cognitive decline.
Be concerned about. Yeah.
And I think a lot of us felt it too. I mean, I know I did. So I know we got to wind up our top 10 list here. Number 10, changes in mood or personality. I think of this as someone really seems kind of different from how they were before. It might be irritability. It could be depression, anxiety, anger. Could also be, they're kind of giddy. So it doesn't always have to be sort of a negative. Or they do or say things they never would have done. That's what we're talking about here.
Yeah. And I found a normal age-related change is maybe losing a little bit of the filter. So I found that as I experience older adults, much older adults, they might say things that, they would have really tried to kind of position,
soften a little bit.
Yeah. So that isn't concern unless it's a real change in personality and it's starting to happen all the time and it's disruptive. So
it's probably related to frontal lobe too. I mean, I think our frontal lobes start to, so that filter, our filter is located right here.
Yes.
So
let's, when should I, Elizabeth, tell me when I should be concerned if I'm experiencing this or someone else's.
Yeah.
And then I'll share it could be something else, not necessarily dementia.
Absolutely. Absolutely. This is warning signs of cognitive changes. So it doesn't mean Alzheimer's per se, but of course, people with Alzheimer's do experience these. So that's the thing. What I encourage families to do, and I did this in my family, is if I see 2 or more of these, I would want to get it checked out. Or if there's one that's really severe and causing major issues. So the way that that we did it in my family, and I've got some helpful tools that Sally's lined up for us to share with all of you, is to compare notes. So I know what I was seeing in my mother's circumstances. And so I asked my siblings, I gave them these and said, all right, here's what we're looking for. You independently see how many you think there are. And together we compared our notes, and we all had 3 or 4 that we clearly saw. And they overlapped. It was like, yep, I've seen this, I've seen this, I've seen this. So I would say if you see 2 or more, and there are certain ones, the memory changes that disrupt daily life is a major one. I would have to say number 3, difficulty doing familiar things that they could do with no trouble. And then confusion with time or place. If that's serious, that would be not even wait. I would go to the hospital. I would talk to the doctor because it may be delirium. There may be a medical thing happening. So again, it's not just Alzheimer's. It may be a medical emergency.
Right. And so some of the medical reasons as we get older, it could be a vitamin B12 deficiency.
Mm-hmm.
That will actually present as
it looks like
confusion.
Alzheimer's. Yeah.
It does.
Mm-hmm.
A severe urinary tract infection is
Yes.
another one. And then you mentioned delirium, which is often caused by medications. And sometimes, as you know, Elizabeth, people start taking, didn't your mom start taking
Dramamine? Yes, that was a big shock. I thought, who takes Dramamine every day? Well, turns out my mom did. And one thing about Dramamine, if you've ever taken it, how do you feel when you're on Dramamine? It's like the weirdest, heavy, loopy kind of thing. Imagine taking that every day. It is anticholinergic. So what is that? Well, the Alzheimer's drug, Aricept, is essentially trying to build acetylcholine to improve memory. And Dramamine and a whole host of other drugs are anticholinergic. They do the opposite. So that was an example.
So what I'm going to do, Elizabeth, is we have so many questions that have come in. I know we have more content.
Yeah.
So I'm going to let people know that this entire program will be recorded, and we're going to get through all the content, but I'm going to stop and I'm just going to take the questions that have been asked.
So sure thing.
Because I think that they're really good.
Yeah.
So someone asked, do you have an opinion on the role of long-term cannabis use with moderate alcohol on the progression to mild cognitive decline? Do you think that there's
interesting? I would have to separate those two things. So you said alcohol and cannabis. So let's take alcohol first, okay? Because frankly, I think we know a little bit more about long-term alcohol and its contributions. For some people, it's not a guarantee. If people have alcohol dependence or a strong history of alcohol abuse, that they will necessarily end up with a dementia. But there are individuals with an alcohol-related dementia. It's called Korsakoff's. And when I worked for the VA, I actually worked with some veterans who had this. The amazing thing is that when they stopped drinking, they regained a lot of functioning. And so for someone who's starting to have, and usually it will be amnesia, it'll be really serious memory issues. And also that drawing thing that I mentioned can be a challenge. But if they stop and they don't start again, they can regain a lot of their functioning. So alcohol is a concern, especially if it's more than, for men, 2 glasses a day, women 1 to 2 glasses. That can be an issue when it comes to cognition. Cannabis, I think we have a whole lot to learn about cannabis. So I do know individuals with dementia who are taking cannabis. The evidence, there's not a strong body of research yet, I think, to really tell us. If your question is, does it raise the risk? I don't think we even know that. There's so much we don't know about history of drug and substance abuse and risk. But damaging the brain certainly, I think, puts us at risk. There are lots of ways we can affect our brain. And so I think in general for brain health, it would be a concern.
Yeah. And I, to your point, Elizabeth, what I'm excited about is there's more research going on early on in middle age to see what happens in later
later.
life. These
Mhm.
studies are hard to do because you have to wait like 15,
A
20,
long
30 years.
time.
So it's part of the reason we
Absolutely.
don't have better research.
Yeah.
Here's a great question. I had a stroke almost 3 years ago. How do I figure out whether my cognitive changes, like memory issues, are due to the stroke, or advancing age or cognitive decline? How do you separate them? How do you know?
That is a great question. Now, there's a couple of different ways. So sometimes, and I'm going to make an assumption that you have not previously been tested, because that's the ideal, right? If there's a baseline, then of course you know. But neuropsychologists and other psychologists, as Sally said, I'm a clinical psychologist. We have norms, so we can get a sense of, given your age, your gender, your education level, your work background, we have norms, so we can give you a sense of how are you relative to other people of your age and gender and education. It's not perfect because, of course, we're all a bit different, right? But at least it could give you a sense of here's how you are relative to thousands of other people your age. The thing with strokes, and first off, I should say, I'm sorry to hear that you had a stroke. Such a scary experience. The good news for many people who've had a stroke is that they do recover a lot of their function. And so doing what you can, and I don't know if we're going to get to the brain health discussion about exercise and diet and all of that, but I would say really, really work on the lifestyle. You want to reduce your risk of another stroke. That's the biggest.
Yeah.
And then see what you can do to boost brain functioning. I hope that's
And
helpful.
we'll take one more question, and then some of the questions deal with those risk factors, so we'll
Oh,
move on.
okay.
And I'm
We'll
just
go
going
to
to let people know, normally our program ends at 10 minutes to the 12 Pacific time. If you need to drop off, just know that this whole program will be recorded, but we may go a little bit longer. Here's the last question I'll pose, and then we'll move on. How does the type of dementia affect treatment?
Great question. Yeah, so there are different treatments or lack of treatments actually for some of the different types of dementia. So Alzheimer's treatments are typically not going to be good for someone with frontotemporal lobe dementia, for example. And some treatments are actually counterindicated for certain types of dementia. So I'll give you an example, Lewy body dementia. In Lewy body dementia, people have to be really careful that they don't end up being put on certain types of psychoactive drugs. Some of the commonly prescribed medications for like agitation can cause a person with Lewy body dementia to be absolutely stiff, like a person with Parkinson's would be if you gave them one of those drugs. So you want to know what to avoid, and you also want to know what might be helpful. That's the biggest thing, I think, is that there's Alzheimer's drugs, some of which could be useful for others, but then there are those where the Alzheimer's drugs you don't want to take there. It's not one size fits all.
And I think it's a matter of, working with your neurologist or your family physician or whomever your healthcare provider is, to push for, well, what kind?
You
Like,
have to
what is
ask.
this? Yeah.
You
Yeah.
have to be assertive. That's what I learned living through this with my mother. I was really taken aback by how hard this experience was. It was hard to figure out what was going on. It was hard to have the conversation, and it was hard to get a diagnosis. And that was just to get to almost the starting point. So you have to be assertive and read and reach out to the Alzheimer's Association and other trusted resources so you're equipped with the right info. And I did find when I was equipped, providers listened. They
Yeah.
did stop.
Yeah. And I'm going to share that in a slide. It's going to come in your follow-up material. Elizabeth, are you good to go until the top of the hour?
Yeah, I think I
Okay.
am, Sally.
So
No
we will
problem.
officially end 10 minutes late. If people can stay on, that's great. But again, this will all be recorded. So I think this is just so important, not only reducing the risks, but if you have mild cognitive impairment, making sure it doesn't get worse. And Elizabeth, let's talk about that. So people want to know, is it in my genes? What if it's
Yeah.
my genetics?
Yeah. So as you can see on the slide, there are non-modifiable risk factors, and we all are dealt certain cards, right? As we get older, we know our risk of dementia goes up. Certain genetics play a role. And by the way, the genetics can vary greatly depending on your race and ethnicity. So it is not a simple story when it comes to genes. And then there is our gender. So women, we are at greater risk. Individuals who are Black and African American are also at greater risk, as are Latinx individuals. So we've got all these things. We can't do anything about those. So what we need to do is see, given my risk profile, what can I do? So we just talked about substance use. So there's actually some evidence that a small amount of alcohol, and probably you've heard this, is actually kind of good for your brain health. I have no idea why that would be, but okay, hey, we'll take it.
Yeah, it's tied to the Mediterranean diet, which is the glass of red wine per night. But a lot of people see that, and then it's like 5 glasses of wine or 2 glasses of wine,
quantity
or other. Yeah.
Quantity matters, but what was interesting, they even found it with other types of alcohol that didn't have the antioxidants.
Yeah.
So yeah, education, the more education you have, certainly formal education, that is helpful for brain health. But I would say the fact that you're here today is a really good sign, because it's that continuing education. And Sally, I love Sally's story about her new chapter and her research and all that. So you're a great example, Sally, of brain health.
And it all pays off. All pays off.
Yeah, that's great. Traumatic brain injury, you've no doubt heard, that can lead to chronic traumatic encephalopathy and also can raise the risk of Alzheimer's. Physical activity is a good thing. And actually one of the best ways to reduce your risk of developing dementia. Also blood pressure and cardiovascular health, making sure those are taken care of. Sleep, we are learning a lot about sleep quality, and what happens in our brain as we sleep as it relates to removing amyloid from our brain. Diet, you just mentioned Mediterranean diet, the MIND diet is also very, very effective. And then cognitive and social engagement, maintaining relationships and challenging oneself has an impact, as well as other environmental factors. So it's a whole lot that I just covered, but it all sort of goes together in terms of your overall risk. And there's even some research that allows you to do a little bit of a survey and see what's my overall risk. Did your mom have Alzheimer's? Okay, well, that's going to put you in a higher risk group, right? But what about these other things? How can you reduce the risk by taking care of these? So
yeah, and looking at the overall risk. So there was one of the questions in the Q&A was, should I continue writing and reading and socializing?
Yeah,
yes,
absolutely.
So what I find interesting, because a lot of my research is on, how we can delay the onset of chronic disease like Alzheimer's, for example. And there is a lot of research out there, but these 3 are probably the areas that have been studied the most, and not just physical activity, but this combination of diet, physical activity, and then cognitive and social stimulation. And researchers estimate that 40% of dementia cases could be prevented or delayed by targeting these. And I'm excited. We're going to be having Annie Fenn at a Future Wellness Wednesday talk about healthy diet. She's the founder of the Brain Health Kitchen. We're going to have Dr. Quinn Kennedy out of Stanford. She's an expert, a psychologist, and an expert in cognitive aging. So we're going to be talking about all of these in more detail and what you can do. But there's some new research, and I think it bears mention. Elizabeth, talk about blood pressure.
Yeah, blood pressure. Thanks, Sally. Blood pressure is a major area of focus. So there was a study called the Sprint Mind study, and this was where they were looking at blood pressure and controlling blood pressure. And what's the difference between people who are at, let's say, 135/90 blood pressure versus 120/80? And what they found was a significant difference between 135 over 90 and 120 over 80 with regards to cognitive health. So much so that they stopped the study and said it is irresponsible for us to keep people at 135 over 90. We need to be managing to 120 over 80. And it was almost 20% reduction in risk of cognitive impairment by controlling blood pressure. Now, here's the key. In midlife blood pressure. So that's talking, I guess midlife is like 30s and 40s, maybe 50s, but it's early. And what we know is that high blood pressure in midlife can lead to dementia in late life. So we all need to be really attentive to what are the numbers. I don't know about you, but when I go to the doctor, if it's 135, nobody bats an eyelash.
Yeah. And they should. We need to say, hey, bat an eyelash. How can I get this reduced?
Exactly.
And also, for most of the people on this call are maybe 60 and older. If you have kids not that we can tell our kids anything, but your children need to be concerned.
Absolutely.
Like deal with this blood pressure head on.
Yes. I did not know this because I had high blood pressure at pretty young. I think I was in my 30s, and I would be like, not that worried about it. And now it's like, I'm doing everything I can. Now, I do want to say some people will say, yeah, but you've got to be careful. Of course, some people have more complicating factors with blood pressure. We're not giving medical advice here, but just be aware. There's some evidence out there that even a little bit more has an impact on your brain health.
So to recap, because I was looking at the Q&A, somebody said, is it possible to have, Alzheimer's without the genetic risk factor?
Absolutely. Yes.
It's also very possible to have the genetic risk factor and not develop Alzheimer's or not to develop symptoms of Alzheimer's, because you may still have the changes in the brain, but not necessarily the symptoms of the disease.
So there's different types of genes. There are certain genes for Alzheimer's that are pretty rare. And if you inherit those mutations, you will develop Alzheimer's, but they're rare. Most often it's a risk factor gene. And in which case, Sally, what you said is absolutely correct.
Thank you for that clarification. Okay, in our 2 minutes that we have left, we're going to talk briefly about getting help, but we're also going to point you to some resources that I'm going to be sending in the follow-up material. Tell us about this, Elizabeth.
Yes. One of the hardest things to do is to talk to someone about concerns. At least that was true for me. And so one of the suggestions that I have is, if, let's say, in this case, it was my mother, I could see changes and there were enough that I thought, this is not good. So I was ready. But what I asked her is, Mom, if I ever notice changes, what would you want me to do? Would you want me to say something to you? And I did that because I wanted her permission. Obviously, I wanted her permission to say something. And I was afraid that if I didn't get her permission first, you could be met with a whole lot of resistance. Now, she could have said, I don't want you to talk to me about it, go away, in which case I'd have to regroup. But this is an approach that I think is a great first step, is to say, would you want me to say anything if I notice something? And thankfully, she said, absolutely. And then you need to be ready with details of what you've witnessed.
Yeah. And what I love here, and I'll just take this slide, is that the Alzheimer's Association has so many tools that are super, super helpful. And like I said, I'm going to be sending you a link to these so that you at least have a place to go. The other thing that I will offer is that, because I know we're a little bit out of time here, is if you have additional follow-up questions, send them to me. I will try to answer them, or I'll get Elizabeth involved. But we have a mission. We're here to help you. Elizabeth, what's one final takeaway? If people walk away from today's webinar and you want them to remember one thing, what would that be?
There is hope for the future. So we don't have readily available disease-modifying drugs yet, but we believe we are going to, and maybe even in the near future. So we're going to have to all pay attention and find people who are experiencing difficulties sooner. And so talking to one another, supporting one another, someday we are going to get to that point where we can identify it and do something about it. And so I hope you'll all join us, reach out to the Alzheimer's Association. We're happy to engage with you. And Sally, thank you so much for inviting me. It's a true pleasure.
Great. And thank you everyone who stayed on a little bit longer.
I love that, Amy. That's great. All right. Have a wonderful day. Take care, everybody.
Bye.
Bye-bye.